Last week, John Travolta and his wife Kelly Preston announced that they are expecting a baby. Preston, who is 47, is among the growing trend of women still having children later in life. What are the risks involved? And joining me this morning is Dr. Sudi Moeen. She is with the Women's Integrative Center for Obstetrics off of Pomerado Road in Poway. Good morning.
Good morning.
Thanks for being here.
San Diego.
Well, thank you for being here. You know, a lot of my girlfriends have had babies over 40 and have had successful pregnancies, and it doesn't seem all that unusual to me anymore. Now, 47, that's a little bit different.
Well, as we know that the couple were talking about, Kelly Preston they were talking about having a baby about 3-4 years ago, and that would have been just an okay time to probably preserve some eggs and embryos and save them up and use them at 47.
Right.
So this brings me to the topic of having children at a later age in life. And it is very possible with the modern technology. It's we have come up with a lot of inventions that makes having children possible for women. However, it is complicated. There's a lot of information involved. So when we ask the question, how can we have children at a later age, it's very important to also provide education to women. So, for example, when my patients come to me for their annual exam and they're in their 20s, Sandra, I pay attention to their career. And I ask whether they want to pursue a degree in a postgraduate school, for example, or have a career that's going to take a long time for them to accomplish.
Because that would mean that their childbearing years are going to be pushed back.
Exactly. So then I tell my patients, what are your goals? Do you want to have children? And if you want to have children, how do you want to have them? When do you want to have them? Do you want to have them when you're in school or later? And if they want to, most of us postpone it, of course, because now we love our careers, and we also women, we want to have children.
How difficult is it to get pregnant after the age of, say, 40 or 45?
Well, right now in my practice, I have a 43-year-old patient who got pregnant with Clomid cycle. So a little bit of help.
With infertility drugs.
Infertility drugs. So it is possible. However, when we get older, the chance of pregnancy drops from 25 to 30% every month that we try to conceive to 5%. So the chances are less.
What are the risks? The risks of pregnancy in an older woman?
In older women, getting pregnant could increase the risk of having premature babies, risk of preeclampsia, gestational diabetes, higher risk of getting C-sections, but these are the risks that any woman could have. It's just higher in those women.
You mentioned options. There are also options when it comes to pregnancy. I mean, we don't know what happened with the Travolta's case, but she could have had donor eggs, right? I mean, what are some of the other alternatives that could have happened here?
Okay, right now with the modern technology, a woman in her 20s could choose to save her eggs. She could either freeze her eggs or save it as embryos, which means she chooses to have an anonymous donor, sperm donor, and by the way, it's only $250 per vial. Very cheap. Wow. And they could pick very smart people, very college students, medical students, and or they could just freeze the egg alone and later on thaw it out and mix it with their partner's sperm. If the patient is in her 20s, the option of freezing eggs is better because younger eggs, they survive thawing out better. But if they're in their 30s, I say, well, let's talk about embryos, freezing embryos. And you could freeze those, it's called cryopreservation, for years and years.
Right.
And you thaw them out, you just make sure you get a lot of eggs and embryos saved up.
So if you're going to push back, ladies, if you're going to push back childbearing, maybe freeze your eggs. That might not be a viable option for you. Interesting. Well, we're just hoping that the Travoltas have a very successful pregnancy, and it looks like it's going that way. Dr. Sudi Moeen, thank you for coming in this morning.
You're very welcome.
Pleasure to meet you.
Thank you.